Virginia just launched 988, which is the equivalent of 911 for behavioral health services. So that individual, a family member of that individual, the law enforcement standing with that individual can contact 988 at any point, at any time, and receive support to dispatch and connect that individual to the services they need in that moment. And so we serve as oversight in Virginia. This is implemented regionally through the Department of Behavioral Health and Developmental Services, who provides our oversight. And we implement for our region in connection with our other regional services boards to provide the oversight for that call center who operates 988 for the state of Virginia. They can deploy mobile crisis teams, and so that's teams that can meet individuals where they are in the community. If they do not meet certain risk criteria, they can direct individuals into lower levels of care. So hospitals are pretty extreme level of care, and they're necessary, but there are other options available, like residential crisis stabilization units that are less high need and high acute than going to the hospital. We provide one at our Rappahannock Area Community Services Board, one of those residential crisis stabilization units, our Sunshine Lady House. But just so you know, our emergency services are available 24 hours a day, 7 days a week, 365 days a year. They complete on average about between 400 and 450 emergency assessments each month across our planning district. Another service that we offer, and very proud to say, it'll come and you'll realize the impact of how proud I am to say for King George. We currently don't have any wait lists for our services. We are truly your public behavioral health safety net. We do not turn anybody away based on inability to pay or payer source. And King George is actually the only clinic in our 5 localities that doesn't currently have a wait list. That's because we've been able to maintain consistent staffing here. And so King George residents can present to the King George Clinic. We do hold same-day access hours where an individual could present and get an intake and evaluation for service that day. That's in addition to our all-the-time response with emergency services for individuals in crisis or experiencing suicide ideation. I won't go further into that unless there are specific questions, but I did want to highlight that on the screen and in your presentation, you see the examples of the array and continuum of services that we offer for the community.
So there was a question,
Sure.
Mr. Chair. You speak of the clinic in King George. Is there a clinic in King George?
There is. We have a clinic. We have an outpatient clinic just down the road in all of our 5 localities. And that clinic provides, out of that one building, that clinic provides counseling, mental health outpatient services, substance use services, case management, medication management, and psychiatry services, both for adults and adolescents. We provide group services. We provide a wide variety of services at that clinic on both our behavioral health side and our developmental disability side. We have 29 facilities across the 5 localities in Planning District 16 that provides a variety of services. And that doesn't count those that we provide kind of in people's homes in the community.
Where's the clinic? Where is it at?
It's off of, it's right down the road. It's at the kind of corner right across from the high school. Again, yeah, yes.
So could you send an address?
I can provide you with an address. I'm embarrassed that I don't have it off the top of my head. It's near Fox's Way. I could tell you how to get it. I'm from Caroline County, and so my directions
Hold that against you.
Past the tractor, go towards the big tree, but I can give you the address. So that's how I tell people how to get there, which is not always impactful. So these are general information about the community who we serve. Annually, we serve between 20 and 21,000 individuals a year for direct services across our service array. We've reached more than 260,000 of our community and community members through trainings, events, prevention campaigns, Rapid Revive, which is a naloxone training, that can help provide life-saving training to individuals in our community. Adverse childhood experiences, we provide partner with the school to provide adult mental health first aid, child mental health first aid, and we just received funding through RAHD to be able to offer in some of our localities teen mental health first aid. Um, we stay pretty busy. Um, our agency is guided not only by mandates, but also by a strategic plan which outlines our vision for the services that we provide and how we support the individuals in our community. I'm not going to go through that strategic plan because I could keep you here all night talking about the plans that we have and how we're going to get there. But I do want to key in that we have a three-pronged approach. We want to support timely and holistic and appropriate services to our individuals. We want to make movement to ensure that we are maximizing the operational efficiencies to create the most effective delivery service. But the biggest one and what anchors everything we do, especially this year, is our workforce. And so the biggest priority in our strategic plan is to recruit, hire, and retain a talented, diverse, and well-trained workforce. We cannot do any of the mandated or good work that we do without having our workforce. And so that will also come into play and impacts what we're asking for in the local funding request. A little bit about the general state of workforce. 96% of all licensed professional counselors, 95% of all licensed clinical social workers, and 91% of all of licensed professional counselors. I'm sorry, that's repeated. That in Virginia currently work in a metro area. Newsflash, none of our localities in Planning District 16 are metro areas. So we have to fight with the rest of Virginia for that about 5 to 9% of the workforce. Virginia ranks 39th in the U.S. For access to mental health care and 41st for the availability of behavioral health workforce. Also, this may be relevant in King George if it's like Caroline. I know it probably is. Many communities that lack these behavioral health resources also lack consistent broadband internet access. So telehealth services are not a viable replacement. Um, and and what we see and what you'll see through, and you've heard today through the community health assessment and the community health improvement plan by Rappahannock Area Health District and Mary Washington Healthcare, those localities with less access to behavioral health professionals have poorer outcomes on behavioral health indicators than those with more access. And also, behavioral health impacts everything from physical health to economic health to family stability and to community contributions. Speaking of that study, I pulled some data for you from that assessment. As a reminder, Rappahannock Area Health District and Mary Washington Healthcare Foundation did a very comprehensive process that engaged over 350 community partners within Planning District 16 and received over 2,000 responses to the survey to collect information around the priorities, as well as having locality-specific representation and focus groups to make sure that they were capturing the needs of our localities here in Planning District 16. As a result, you can see some of the things. I'll draw your attention. The first in the corner, it's mental health provider access. If you look at King George, as far as the ratio of population to mental health providers, it's 2,440 to 1. The only one in our planning district with less access is Caroline, my hometown. But it's significant when you look at our other localities and compare that. I provide the information as you move to your left of your screen on the rate of drug overdose. This is specific to opioids. This is a crisis in our community. Want to point that out, and I definitely want to highlight this number at the bottom of your screen when you are looking at suicide rates per population. King George is the highest out of all of our local area. out of our the rates of suicide are the highest here in your county, and exceed the average of the state. As part of this community health assessment and the subsequent community health improvement plan, these community stakeholders worked with Rappahannock Area Health District to determine 3 top priorities. Priority number 1 is mental health. Priority 2 is housing, and priority 3 is access to health care, to include access to mental health. This is a crisis in our area. We need to support these services. Our individuals are saying, and community partners are saying, we need it. So RECSB requests local funding to support our programs and services. In the past, last year, in fiscal year 23, we requested a total funding of $1,912,000-ish from the localities in our planning district. We are requesting across the localities this year a 15% increase in additional funding, totaling $249,000-ish. And we propose to use this money to help support and supplement the salary increases that we need to retain and hire staff. Talk to you a little bit more about that. And so we are requesting a total of $166,000 from King George. This is an increase from our request. We'll talk a little bit about those details, of about $20,000. So as part of our workforce that we're seeing, not only is Virginia struggling with their behavioral health workforce, so are we, and it is at a mission critical level here in our planning district. We have had to temporarily pause 2 of our programs in order to address staffing needs. And we realized that we were not competitive. RECSB, as a public behavioral health provider, was not competitive with our private counterparts, nor were we competitive with others in our market base. And so we contracted with JER to come in and complete a comprehensive classification and compensation study that was just recently completed. And this year we implemented, just in the past 3 months, in order to right set our scales and bring our employees up to compete with the market, so that we can shore up the services that we provide and position ourselves to expand our services to meet the expanded needs in our community. That costs an additional, not total cost, an additional, just to right set that, an additional $2.5 million that we are assuming on an annual basis, so that we can right set and attract our workforce. And so that is why this year, from all of our localities, our local funding request is tied to supporting that initiative. So that total, just in increase this year, is about $2.5 million. Our total request for local funding from King George is $166,000. We're asking for an increase of about $20,000. So the services we provide to individuals. Last year we served, again, you can see the split of how those individuals are served. I've highlighted King George. We served close to 2,000 individuals here who lived and indicated they were from this locality. As far as the percent of total individuals served that we served in RECSB, King George represents about 9% of the individuals we served last year. I have put our 2003 actual receipts for local funding from each locality, highlighting King George's receipt. I've also put on the board what our request this year for local funding is from each of our localities, as well as what the change is from the prior year request. And as we mentioned, we're asking and requesting an additional $21,675 from King George to support helping us assume that additional $2.5 million to attract our staff. And of course, you can see across localities, we are asking for a 15% increase across all of our localities. So what do you get for your money? Where is the bang for the buck for the individuals and your constituents of King George County? So across our planning districts, I mentioned that we provide services to individuals regardless of their ability to pay. And so total from all localities, we received about $1.4 million in local funding from all of our localities, but we provided close to $4 million in financial assistance to individuals seeking services. So the individuals we serve are benefiting, and we are giving back to our communities about 3 times what we're asking them to invest in us. An overview of our total revenue source. That circle up at the top of your screen represents our total budget. And so we receive about 26% of our funding from our state sources. We receive about 7% from federal resources. We receive about 3% of our total budget from localities. The rest are made up with about 1% of other funds, and 62% are fees that we collect from our individuals served. I want to draw your attention to just a piece of that. So the state funds and local funds for our performance contract with the Department of Behavioral Health and Developmental Services and Azure Agency of Local Government localities so the planning district localities must provide a match of no less than 10% of our state funds. When matched to our state funds, they have to provide a 10% match. Our local funds equate to about 17% when we compare it just to the state funds that we receive. And the circle on your right is how that 17% breaks out by locality. And currently, King George provides about 1.5% of that 17% match that we have for our state funds. Long story short, the need is increasing. We need it here, not just everywhere else. Our need is here. And our system is changing. With that increased need comes increased administrative burden, increased documentation, increased proving that the services that we do are effective. And we need a well-trained workforce. In order to have and keep a well-trained workforce, we need to leverage our community partners and our localities for support to help us keep our workforce so that we can keep providing the same quality services that we have provided for our localities for over 50 years. That's it. Any questions?
Ms. Williams, thank you so much for the thorough brief. Did anyone have any questions or comments? Ms. Bender?
Yep. I have noticed on there that we are a higher percentage than Caroline. They have a little bit more of a population. Is there any reason for that difference?
That is based on right here. That is based on what they have provided. I'm going to go back to individuals served. We serve. Our request is a little bit higher than it is for Caroline because, as you see here, we're looking at what percentage of our individuals that we serve allocates to the county, and Caroline's at about 7%. You guys are at about 9%. So we serve more individuals here in King George than we serve in Caroline County.
All right, thank you.
Yes, thank you, Mr. Chair. Thank you very much for your presentation this evening and joining us. I had a question, and first I want to state I fully support your mission and the work that you do, but I have a question about your data.
Sure.
Would you mind going back to the slide that had the suicide percentage rate by locality, please?
Yes. And that is pulled. That was not generated from the RACSB. That was generated from the
CHIP.
Yes,
Yep.
the CHIP.
I'm well versed
Perfect.
in the CHIP. Yep. So I would just caution, because we had the same issue with the COVID data, when you're extrapolating numbers for localities that don't actually have 100,000 citizens. Many of the localities there have 100,000 citizens, so they have a more accurate rate of reporting because they have the numbers. We only have 27,000 citizens. So like during COVID, it looked like we had a raging COVID problem here when we maybe had 3 people in the hospital at a given time, or we had 2 deaths one day and it looked like we had lots of deaths per 100,000 because you're multiplying, but we don't have the population base. So I would just caution, I get the point that's being made there, but I'd be more interested in just seeing what's the number in that case. Thank you very much.
Very helpful. Thank you.
Anyone else? All right, thank you so much, Ms. Williams. All right, Fredericksburg Regional Food Bank, Mr. Dan Marr.
Thank you for the opportunity to be here with you tonight. I have just a couple pages to draw your attention to. Most of what I will be sharing with you, I think, will come from my remarks, but I will pass this around so you have it in front of you to refer to when it's time. And I want to certainly thank you for the opportunity and thank you for your bravery listening to all these presentations and the patience you exercise in doing so and the uh, importance of your duty. Certainly doing this during the dinner hour will make my points all the more tangible since we're all kind of facing hunger a little bit. But I think most of us will have the opportunity to go forth and satisfy that hunger within the next few hours. Whereas what I'm trying to highlight is the need within the community which will largely go unsatisfied without the resources that we're requesting being made available to us. And coming at the tail end of these other presenters is a great occasion to be able to celebrate the great partnerships we have within the community, and the food bank being a very essential underpinning organization, not only in King George County, but across the entire region. All these organizations in some fashion would readily acknowledge, I know, that they benefit from their relationship with the food bank because as the principal resource of charitable food assistance in the community, even those who focus, say, on mental health, know to refer those that they serve to the food bank and its broad network across the region. And even when it comes to pet food, we're able to work with the SPCA when we get donated products that come in for pets. We know where to share those to. So there really is a critical nature that the food bank serves within the community that is important to recognize as an essential service within the community. And I'm going to lead off with the page that highlights food insecurity. And what that in the interpretation of food insecurity is essentially someone who is not able to guarantee or a self-provision of enough meals, 3 meals a day, to guarantee them a healthy, active lifestyle. And you can maybe take some rightful pride that the economic strength of the King George community has you as just the second highest, or second lowest, I should say, second lowest food insecurity rate within the region, bested only by Stafford County's 5%. But 5.6% is still 1 in 18 people within the community. And so we have to recognize that there are nearly 1,500 people in the King George community that are ascribed to be, by the data, food insecure. And then there's a much broader marginalized community as well, which maybe does not face chronic food insecurity, but certainly faces food needs, because very often those who benefit most from the services of the food bank are those who do not quite qualify for SNAP benefits. When people can receive the Supplemental Nutrition Assistance Program benefits, they have an additional resource at their disposal, whereas those who may be just marginally outside the parameters of the SNAP benefits requirements, they have perhaps an even greater need for the food bank. So poverty itself is not the only indicator of someone who may be coming to us for services and having needs that we are called upon to satisfy. And so that 5.6% rate, while it establishes a baseline of those who economically would be deemed food insecure, does not tell the whole story of food insecurity within your community or across the region. So the data for King George County, for example, is that 1,480 people are estimated to be food insecure. Of those 1,480, 430 are considered to be youth 18 and under. So that gives you the lowest food insecurity rate for children. But again, can we go to bed comfortably knowing that more than 400 children in our midst are going to bed facing hunger? And so we have to have that recognition that hunger, while not perhaps immediately a solvable problem, is certainly something that with a community cooperation, there are resources at your disposal to address more powerfully. And so the second page shows you the resources within King George County that have aligned themselves with the food bank. We are the Feeding America Network member responsible for essentially parts of 5 counties and the city of Fredericksburg. And that territory comes to us by assignment from Feeding America, which carves up the entire nation and delegates to a food bank within that territory the responsibility for working with its local communities to establish a network of partner agencies which will receive food from that food bank and be responsible for, in a sense, being the boots on the ground that put that food out to the residents of their more localized community. And so there's a modest number of partners in King George County, but a very effective reservoir of partners, I would indicate to you, because in the past calendar year, the partnerships we have in King George County received food from us that resulted in the generation of 756,000 meals for the community. Now, when we look at just that baseline number of roughly 1,500 food insecure people, since all of us eat 1,100 meals a year, if we're fortunate enough to have 3 meals a day, that requirement for just the baseline food insecure number would be more than 1.5 million meals to help them meet their daily requirements of nutrition. So even though our partnerships were able to generate a very impressive number of 756,000 meals, you can see there's still quite a gap from being able to satisfy all the needs of just those who are basically food insecure, let alone those who sometimes face food insecurity on a seasonal or a cyclical or a special purpose basis. So an investment in trying to undergird food security for your community has really a multiple effect, and an effect that I think we can all appreciate as founded at several levels. For example, by providing food for your community, you're investing in the nutritional well-being and the overall health of your community clearly. You're also investing in the educational capability of your community. We know that students who go to school hungry are not students who are capable of learning and growing and developing properly. And then thirdly, as an example, many of the trade-offs that people in the community face are around the issue of food. When people are struggling to make ends meet, they have to make decisions about, do I purchase food or do I pay my water bill? Do I purchase food or fix my car? Do I purchase food or get my medicines? And so to the degree that more food can be available in your community and take that trade-off off the table for people, you are investing in the economic well-being of your citizens as well. So the request that we are making to you, and it's a very modest request given the scale of service that we try to offer within your community, is an investment in 1 week's worth of food for half the food insecure population of your community. Just asking 1 week from you for half of your residents. Again, not that that's something we should celebrate as sufficient, but a modest investment, because certainly as a strong partner in the community, we have other assets we can reach into and try to fulfill the needs even here in King George County. But we certainly ask you to have an appropriate level of basic skin in the game as we invite your commitment as a locality funder. The way we get to that figure is the efficiency of the food bank by working with so many partners for volunteer service, as well as donated food supplies that we're responsible for soliciting from the community. We are able to provide 2 meals for $1 when we look at our historical trends. And that's not because we're miracle workers, but because of our ability to leverage those assets of donations from the community, donations of labor, donations of food, and especially working with many retail partners around the community to receive food from them on a donated basis. So the baseline of providing a week's worth of food for half the food insecure population is $7,770. So that is our baseline request for addressing the short-term and immediate hunger needs within your community. We are asking each of the localities for an additional $10,000 to invest in a long-term further solution that we intend to inaugurate, a mobile market, which would be the ability to, in a sense, bring especially fresh fruits, vegetables, products that are not easily accessible in communities that maybe only have access to mom and pop groceries or convenience stores, but to invest in taking a mobile grocery store on a small scale, obviously, but a mobile grocery store into neighborhoods and communities that do not have grocery access. And that certainly is something I think King George can resonate with, given the limited number of national and regional retail chains within your community. So we're asking all of the localities to make a $10,000 investment so that we can have resources to purchase and establish and equip a mobile marketplace. Certainly $50,000 is not going to solve that, but again, we will ask this of the localities and solicit funding from other resources as well to try to make this a reality. So the overall investment we're asking you to make is $17,770. Again, very modest, far from what we spend to serve your community, but the investment that we would like to ask of you to consider given our starting point and our need to grow that relationship more richly and find further ways to collaborate and partner with you. And I would just, in closing, like to really pass a salute to Love Thy Neighbor within your community, one of our strong partners. It's the second most voluminous output pantry in our whole region, thanks to their strong and committed work here within the county. And we were able to recently give them a van costing $95,000 to us through grant funding that was given for the purpose of us trying to equip and strengthen our agencies. And so they were seen clearly as one of the most significant agency partners we have, and we felt that was a very good investment for us to gift to them that $95,000 van to enable them to have more capacity to deliver and pick up food from us and to deliver food within the community. So I would wrap up with that and thank them for their great and strong witness to hunger fighting in our community, and see if there are any questions I can help you address.
Mr. Marr, thank you so much for coming out and providing the information as
Thank you.
well. Do we have any questions or any comments? Mr. Collins?
Sorry. So I noticed on your food assistance partners and direct distribution partners by the region, King George has 7, Caroline has 24. All the other regions have all the schools in there. We have no schools in there. So I'm familiar with, especially the elementary schools. There's a lot of teachers that are providing meals for students to take home, especially on the weekends. So I would encourage you to be partners with the schools.
Yes, and I can address the rationale there. Many of the programs that we qualify for with federal funding can only be administered in schools that have a percentage of 50% or higher receiving free or reduced meals. So King George County, unfortunately, does not qualify for many of the federal programs that we're able to administer in terms of school administering school programs. We do reach out and try to work with your schools on partnerships that do not require federal aid, but yeah, we do need to strengthen that relationship. But I would highlight to you that what we do is offer our services within a community. It is imperative that the community wants to accept those services. And so it is not so much that we are not reaching out to King George as it is that at times King George partners defer and for whatever reason do not establish those relationships. The other counties have accepted our aid more diligently, and that's why you see stronger numbers there. It's not for want of trying.
Thank you, Mr. Chair. Thank you for joining us this evening. I know Mr. Frank and I had the benefit of having you join us for the Department of Social Services Administrative Board meeting this past Monday night, where you shared the food security map. So I had a couple questions, and I asked Ms. Hahn to reach out to you all, and I got an answer that didn't exactly answer my question. So in your request, it says we supported the 7 partners in King George County in addressing food insecurity through the distribution of food sufficient to provide 509,405 meals within the county. In total, our services supported 2,674 county residents. Are those unique
Yes.
Those are
Yes,
unique.
we have a data system which is operated with all of our partner agencies, and they report those that they serve, as well as we, when we engage in direct service, we gather that data and we put it into that database, and it does scrub it for uniqueness because it compares addresses, names, um, gender, things of that nature. So there's always the possibility there could be some duplication that the database doesn't recognize, especially if somebody does not consistently give information as they receive food resources. So there's always the possibility of some duplication, but largely we can rely on that as an unduplicated number, yes.
Okay. So, and I'm familiar with what you do in your direct distribution. I've been to Sedell Brooks Park when you had the truck there and distributing food. But as far as the partners that you have here, like let's use Love Thy Neighbor as an example. When you go there and you're saying you gave X number of meals, are those your boxes or are you counting everyone who was at Love Thy Neighbor that day who benefited some way, got something from their program?
Yeah, we track the poundage that goes out from us, and we only give credit to ourselves for the pounds that go from us. So, Love Thy Neighbor or others can, yes, they are free, and we encourage them to receive other food resources as they can solicit it. But we are the centralized agency that has, through the Feeding America Network, the partnerships with major retailers, the federal programs, so they can only access those the way things are structured through their local food bank. So only the pounds that we handle through those kinds of relationships that go to our partners are counted on our end as meals provided.
Thank you. And then my last question, and you brought up the mobile market vehicle. I wasn't sure if that was different from it was a refrigerated van that you donated to Love Thy Neighbor, so that
It is.
it serves a different purpose. And
Yes, and I appreciate you referencing Sedell Brooks Park, for example, because there are several sites, Sedell Brooks is an example, Oakland Baptist, St. Stephen's Baptist, and others, that we do not list as ongoing partnerships because they are one-off type partnerships. We will occasionally go there and provide direct distributions of food. So we do not consider those sites partnerships, but we are present at other times within the county to try to fill in gaps because we don't have those established agency partnerships. We haven't found people in the county willing to step up and take on an agency partnership or a school relationship. So we fill that gap ourselves. The kind of vehicle we would bring out as a mobile market would actually be a traveling grocery store. So yes, it would definitely be refrigerated. And the asset it would bring too is it would allow SNAP benefits to be redeemed on site. You know, we would be considered a transactional relationship site for SNAP benefits. So while generally speaking, the products we distribute are distributed for free, this would would have some free product, no doubt, but would partner with a retail partner whose food we would purchase, and then we would pass on that cost to the local community by allowing SNAP benefits to be redeemed for that product. So that'll be an asset to the communities because often SNAP benefits are hard to redeem when people don't have transportation or do not have a strong grocery presence in their community.
thank you. And Mr. Chair, if I can just apologize to everyone here this evening if it seemed like I was grilling anyone about their data. I was the county grant writer before being elected. I am data driven. I want to see numbers. Yeah, thank you very much.
Welcome. Thank you. Thanks for the questions.
Anyone else have any questions? Thank you, Mr. Marr.
Thanks for your attention.
All right, I think that was the last of our outside agency presentations. So we'll move on to our action items.
So good evening, Mr. Chair and members of the board. And I've asked Mr. Dines to pull up the list of the one-time expenditures. At the last budget work session, we presented a list of and had the department heads come and talk to you about those one-time expenditures. And we were asked to give you all more time to look at it. Today, I did send you an updated list. We have removed one of the items from that. That was the drone for the sheriff's office. in the amount of $7,000. So I believe, I don't know if it was printed for you all. I know I emailed it to you, and Mr. Dines is trying to get that pulled up here.
Yes, ma'am, we do have it in our packet as well.
Okay. So, with that, I would like to ask that you authorize county administrator to transfer $143,000 from the general fund balance to departments as presented, so that we can, and if you approve this action item tonight, we will remove that from the big sheet that you have tonight on expenditures. And that's why that's preliminary.
So if it's approved tonight, it would remove it from the budget request for this
For
coming
those
up
departments.
year. Yes,
That's
understood.
correct.
Okay. Do we have any questions? Mr. Collins?
So last time we discussed, so the Parks and Recreation Storage Building, so we're building, the general properties facility down there by the courthouse. And we certainly don't need another storage building. Why can't they take one of the ones from the courthouse, when they finish that building? I mean, the more stuff you store, the more stuff it just piles up and never goes away. And the utility trailer, there's so many utility trailers in this county, I think that you could use instead of having your own personal. Every department does not need a utility trailer. The security cameras, the aging K9, the APC backup, I'm good with all of those, but not those first two.
If I may,
Go ahead, Mr. Miller.
and prior to Mr. Clark, but, so the building for the, general properties is obviously the funds were approved as part of the last capital improvements plan, but, you know, the process is going to take several more years. It's not just gonna happen this year because we've gotta do the development of the property in terms of, you know, layout and all that kind of stuff. So, I mean, you're talking about a couple of years away. So I think that
Okay, well,
there
whatever.
is still a need for the,
I still don't want to see everywhere I go in the county a shed. It doesn't look good. If you have so much stuff that you need a shed, maybe you need to call some of the stuff you have.
If I may, so on behalf of Parks and Recreation, we, like at this time at Sealston, we have one single shed that most people would have in at their home. It holds a scarifier and a zero-turn mower. We have to pile the field dry to the side. If you are inaccurate by about 1.5 inches, you rip a bag. I've done it twice. I know the staff member that's up there has done it before too, because now you have turpus laying on the ground. We store additional backup bases and those things on shelves that have been added. At this time, we have added that sprayer spreader to our stock. According to our soil test, we need 10 tons of lime to be applied. That's at Ralph Bunch and Barnesfield Parks. In just the first application, I have nowhere to put it. So to bring in 10 tons of lime, that's multiple pallets. There's nowhere to store it. In the last CIP process, we were awarded the ability to buy batting cages, and we just got our last 9, the second 9 holes for the disc golf course in. The batting cage poles and the disc golf goals that haven't been installed yet are at 3321 Roseland Drive in the garage, because that's the only place I had left to store them. So we're using every space we can, but as we grow, we would love to have 2 garage spaces added to the general properties building, or to have a recreation center built that would also have storage for our staff. But right now, we just, for us to actually do the upkeep we need, we really do need a place to store equipment. The facility at Sidell Brooks Park has the sprayer spreader, a zero-turn mower, and a scarifier in it. That's the shop that we should be able to do work in. In order to do work all winter, they were repairing picnic tables. They had to back out all 3 vehicles, and were able then to work on picnic tables in foul weather, except now the little vehicles are out in the foul weather, and we have no place to store our tractor. It sits out in the open all the time. So yeah, that's where we are with that. When it comes to our trailers, as I explained last time, both of our utility trailers are more than 20 years old. We barely got them through inspection this year, and that's why we need to upgrade and replace. And the idea that there are multiple to use, general properties trailers, once we hit mowing season, are out daily. They don't have an extra. They're running in their trailers every day. They're cutting well lots and pump stations. And then ours, the staff member from Sidell Brooks Park also cuts Ralph Bunch and the pit. And at times is called to help at other localities or other parks to move things. They got to, sometimes have to go down and cut at Wilmot or things like that. So we do need that trailer. The concept of sharing sounds great. We thought there would be a lot of sharing this year with the transition of the parks workers to my department from general properties. There's not the sharing is too hard to do. We are purchasing equipment, whether it's from the general fund accounts or their activity fund accounts, to make sure we have our own equipment to be able to do the jobs we need to get done.
So the trailers you have, the only thing that you need on a trailer is wheels and wheel bearings. And so why would you need to buy another trailer because it's 20 years old? The wiring, you got wheel bearings, and you got tires. And that's all you need to do to get it through the inspection. You don't need wheel bearings to get
Well,
what you,
I
for
can
the
tell you,
road.
sir, that just
So and the storage buildings, when you're buying lime, why wouldn't you buy it in bulk in the first place? As far as, they have those spreaders come out and spread it for you. Why do we need to store lime? I don't want another storage building. I'm tired of seeing storage buildings all over this county. It's kind of like trailers at the school. All that means is poor planning.
Well, I can tell you, so when we get into doing our fertilization program, if we hire a contractor to come, it costs $10,000 pre-COVID. So I don't know where we've gone since then because I haven't priced it. It was $10,000 for them to do applications to 4 baseball fields at Sealston. My total budget for fertilizer is only $14,000. So I can't fertilize every field in the county, and therefore we're not going to be able to improve our fields to attract sports tourism events or any of those things. And so that's why we need this stuff, and that's why we're getting our staff trained so we can do these things in-house for a better more cost-effective manner.
Mr. Clark, I really appreciate the data on the justification for this. I'll be honest, I know Mr. Collins doesn't agree. I think it makes sense. Obviously, I'm not looking to just put buildings in, but at the same time, you need to take care of the equipment you do have, and we need the equipment we do have. We don't want it to wear out and then have to say, hey, let's get some new equipment. I think it makes sense, so I appreciate it. Thank you. Ms. Kupka, hang on.
Thank you, Mr. Chair. So basically, we're looking at the difference between a one-time expense for a storage building to store the materials and labor costs, which our in-house labor handles the work, the actual application of the products, versus having every year a purchased services expense, because that's what you're talking about basically is
Yes. The school
to outsource it is a purchased service. So we're going to be paying more to do it as a purchased service than if we do it in-house is my guess.
Yes, and if you dig, if you were to dig into the school board's budget, they contract out the work on the high school fields. So the baseball field, softball field, and practice soccer field get 3, 4, 5 treatments a year at a pretty healthy cost.
Okay, thank you.
Ms. Bender.
Mr. Miller, I just want a clarifying question. The maintenance storage building that's going to be for maintenance near the courthouse, how long, is that a supply chain issue that it's going to take so while to get that building?
Not necessarily. I mean, the first part of it has got to be to lay out the footprint of the property. Certainly you provided that that resource for us, the commitment in the CIP. And so Mr. Cusenberry and Mr. Muncie are working together on the layout of that. It's kind of a sloped area, so I mean it will have to be built up. So there's a lot more involved in the early prep work. It's not something that immediately is going to go under. We're going to be able to start doing it this year. I think that the first step is that site work, and then you would probably be looking at a 2-year project. I mean, I would imagine. So that's something that is a challenge. I mean, obviously this county is got an incredible demand for services on parks, but also on the other facilities. But it's just over time you've got a lot of facilities that are kind of strung out, and clearly with the parks, you've got the 2 major parks and then now with Sedell Brooks. So Sedell is the most central in the county, but it certainly doesn't have the activity that the other two parks have. But I think, clearly the move towards a centralized garage or general properties facility as opposed to what they are having to do now at Bloomsbury is going to be a great step forward. But it's not something that's going to be done this year at all. I can get you an update. I will talk with Mr. Muncy and Mr. Cusenberry to get an update on where they stand on this, but I know that not a lot of, it's obviously not under construction at this point.
Right. So my question is, I understand totally being coach why you need the facilities and the importance of. I will tell you, the former AD at Riverbend, he was immaculate with his field before they turfed it, and I saw the amount of work and the materials that went into maintaining a beautiful. I mean, it was gorgeous. I think he got upset when they turfed it because it was gorgeous, but I understand how much material is used to keep a field competition ready. But my question is to make sure that this building we built can house everything, because it makes sense to have it all in one spot so we can to take care of it climate control. So I would like to hear an update and make sure it's big enough.
So, Mr. Chair, the building that building for them is not rocket science. Site work and a slab and build the metal building. It's not really. It shouldn't take 2 years to do that. That's a failure of government. You don't go to Spotsylvania, Stafford, Caroline, any of their courthouses and see a bunch of sheds out back. You don't go to their schools and see a bunch of sheds. You see maybe one. We have sheds all over the place. So, Mr. Chair, I'd like to make a motion to approve the security camera systems for the sheriff's office, replacing K9 and the APC power backup.
We have a motion. Is there going to be any second?
Y'all can put a motion on the other two if you want.
Okay. Motion fails.
Mr. Chair, I have another motion. I would authorize the county administrator to transfer $143,000 from the general fund balance to departments as presented.
Second.
We have a motion properly seconded. Do we have any further discussion? All in favor, say aye.
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 Any opposed?
Nay.
Chair votes aye. Motion carries. All right. Preliminary expenditure summary spreadsheet for county departments. Mr. Miller.
So what we're providing you with is, so obviously these items that were just approved aren't going to be in there, but this is the expenditure budgets of the departments for this proposed budget. And I know that what the next step is you're meeting with the school board next week, and then what we want to do is basically assemble a budget that will be inclusive of everything. Is that where we are? We would like to do that. I would like to do that.
Yeah, so this right now just has the county departments. It does not include some of the non-departmental things, the debt, the schools and everything, because we wanted to, see where the next budget work session went, but also to see if, looking at that and give you some time between like now and next week to decide if you do want any of the department heads to come and talk about their budgets at a future work session. So we wanted to give you this so you could take a look at it, or if you want any other information from finance so that you can move forward through
What
the
would
process.
be hopeful is that you use that the April 6th meeting, which is the Thursday, and then maybe the 13th to have kind of the focus on the entirety of the budget. And then we would then have time, if we have to start formulating some strategies to address any concerns. Because obviously you have a lot of asks for the county schools, and you have a number of things associated with some of your departments and things like that. And so we just need to kind of start zeroing in on those dates so that that gives you time to get this in early May. And May 15th is our timeline in terms of having this approved, and then getting the bills out for the taxes and things like that. So that's kind of what we're hoping to do. So you get this you got this information, you got next week with the schools, you know, further direction from you, then we can start forming this thing up in the early April timeframe and have more fuller discussion on those kind of timeframes.
Understood. Did
Mr.
it?
Chair, can we, so you speak of that, can we get some explanations of some of these? Anything over 20% increase, which are 1, 2, 3, 4, 5, 6, 7 of them that are 20% or more. Some of them are as high as 86%. So can we get some explanation from what those raises are?
Over a minute? Yeah.
Yes.
When can we get that?
So do you want that provided, if that's the will of the board, do you want that provided? Do you just want an email from me telling you what is driving that? Or do you want to hear from the department heads? How would you like that handled?
I'd like to hear from the department heads to explain what these increases include specifically.
Okay. So what we can do is that something we can have everything pulled together and then have them come, those that identify what Mr. Collins is talking about, have them come and provide further justification?
Yes, I would just say that in looking at those, there's a couple, like the magistrate's office. Their budget is so small that when they have any increase, it skews everything. I mean, their increase request is only $697, and that equates to a 34% increase. And that's due to supplemental salaries.
I understand what it says. I understand the amount.
You still want somebody from the magistrate's office to come
not,
to a
yes.
meeting?
Mr. Chair, may I ask a question?
Yes, ma'am.
Will we also, Ms. Hahn, I'm assuming in addition to this, you'll be providing us a line by line of each department?
And would you like us to go ahead and do the PDF like what we did last year and just send that to you in email like we did last year?
If that's the will of the board, yes, I think it'd be very helpful.
I would prefer it in digital. I know Mr. Collins likes hard copy. I don't know, maybe
Yes.
would you like a
I'd like
hard?
to have a hard copy.
Okay, yes.
I would like to have a hard copy as well, please.
We'll provide everybody a hard copy and the digital format as well.
When?
As soon as we can
I
get
can
all
work
this
on this
together.
tomorrow,
Yeah.
getting the PDF together and then send it and get Ms. Fish maybe to make the hard copies.
Yeah.
So I'll copy her on it as well and get her to make the
So
print.
less than 7 days.
That's correct.
Could you send me an email when it's ready to pick up, please?
I'll ask Ms. Fish to do that.
Or somebody send me an email. I don't care who it is. Thank you.
Ms. Bender.
Yes, I just want to throw it out there and just so it could be factored in as an option or a choice is every 2 years, the board can look at their own salary. And so I'm just bringing it up because it is an election year and a lot of other localities have. It's not saying we do it. It's just, this is the only time we could do it. So I'm bringing it up as one of the older members on the board.
Fair question. I personally am not interested in entertaining that, but I'll leave it to my colleagues to make a decision if they want.
I'm
to.
just bringing it up because
I'm not offended by it or angry. I just, it's a fair question. Just with all the other requests, we have a lot of requests this year, and I think it's not something I would want to take on.
So I'm not against it. I'm more for it than against it. But I'm not running for re-election either.
I'm just throwing it out there. I mean, you should see some of the other localities, what they're proposing. So
Are you in favor of it? Ms. Bittner.
I'm in favor of just looking at the numbers and bringing it forward.
Is there a, are there?
I
are
was
there a
thinking we've done
particular
it
number-
before,
Are there
5.
particular type of counties you want us to look at? that-
Well, let's ask our,
Or is it a
let's see if
particular
there's a bit-
percentage that we need to be plugging in so that Ms. Hahn and Ms. Cobb can start running it? Or is there some data that we need to
I
be
was thinking of
following?
just 5,000 because that's what we did the last time, and then you factored over the 5 people.
That's fine. I mean, we'll give you the analysis. I mean, you guys ultimately have to make the decision.
That's all I was asking
so it
for.
would be in the presentation as a proposed, is what you're saying, and then we could just say no or yes, either way.
We'll have to have you stand up on the podium and justify it. I'm kidding.
Ms. Kupka, Mr. Stonehill, are you amenable to this?
So I don't have any skin in the game because I'm not going to be here. But we have a great deal of new requests, new staff. I know I personally do way more than what I'm paid, but to me, part of this also, a great part entails service. So I'm not in favor of it.
I don't necessarily need to see it. I mean,
Just brought.
Not to belabor it too much, so Ms. Kupka's not gonna be here, so she's setting it up that the person that's there couldn't vote on it. And Mr. Stonehill, I think he's not gonna be here. I'm not sure. He never told me personally. So there's, and you can't do it when it's not an election year, is that what you're saying?
That is correct. So it would have to wait. To entertain it again, it would be in 2 years when the Shiloh and the James Monroe seat are up for election. It could be considered in 25 again at that point. So
It's a long time to bring it up again.
2 more years. It is 2 more years, correct.
Okay, so next steps then, you meet with the school board and it'll be here at 6 PM on the 30th. And then we've got it programmed in for April 6th. I know obviously that's 3 days before Easter. I'm not suggesting that we can't meet, but if there's any personal needs that you all desire to not meet on Thursday night that week,
Is that
let
the
us know.
Easter break week? I got a request from my mother-in-law to visit, so I might not be able to say no to that request.
So
Since it's her birthday.
Easter break starts on the 7th. So the 6th, your daughter would still be in school.
Thursday.
It was just
It's okay.
because I'm used to the Easter break and the spring break coming together most of the time. So
I was gonna suggest that if you, I know we have the 11th, we have the CIP, public hearing on the 11th. So, I was gonna say that if you had to, you could, if you didn't meet on Thursday, you could meet on, since that's an off Tuesday, for the board meetings.
I will be unavailable that day.
Okay.
And the 11th at
The 11th.
will be at that.
So can we do that as
The
a
planning
placeholder, and you can always cancel it?
Right.
What? Which one?
6th.
I'm Mr. Stonehill, Ms. Kupka. Would the 6th work for you?
I know that Mr. Dines
That's
Mr.
right.
Dines will possibly not be here because I believe that he takes that period off, personal leave, right? Okay.
Thank you for your approval, Mr. Dines.
Okay.
So is that a yes?
Okay, I think the 6th will,
6 is good.
6 will be amenable for everyone to make it work.
Is there anything that you need regarding next week's meeting? I guess let me know, let Ms. Hahn know for your school if there's any questions that you have about their presentation from last week that we can ask Dr. Boyd. I mean,
He's well, I
obviously
think.
you can ask him directly. I don't have a problem with that. I just, we can be your conduit if you need that.
Understood. I appreciate it. Dr. Boyd did as well say he was available to
Okay.
answer any questions. And actually, I think he'd appreciate if we do have questions, being able to hear them early so he can be prepared
Right.
to discuss them.
Right.
So if you do have questions in particular that you can think of, if you could provide those to Dr. Boyd, I think it would be fruitful for a good discussion as well. I think our citizen advisory, I know that we only have one here today, but that's the binder with the school.
Yes,
But
those are the
okay,
binders.
so you got yours. That's good. I'm assuming we could reach out with an email and let them know that the other two, that the binder's here, and they could then come to the county offices to pick it up at their convenience.
Yes.
Okay, that's great.
Mr. Chairman, wouldn't it be proper not to contact Dr. Boyd as a board member ourselves? To go
Well,
through
I
the
was
board?
gonna suggest that it come through me or come through Ms. Hahn because he doesn't
But
technically
his board should know the
answer to
questions.
you, he answers to the school board. So, I mean, if he
They should
failed
know
to
the
somehow
questions.
get information, I wouldn't want that held against him. But I mean,
Okay,
I realize that it would be best that if you wanted to
Yeah.
have some questions forwarded to him, let it come through me, and that, I'm accountable to you and Ms. Hahn's accountable to me,
It-
so.
yeah,
As
if
an
everyone,
elected official on the school board, I think they should know the questions that we ask also. So send it to the proper channels. Make it to Dr. Boyd, he'll answer the questions and
I agree. I'm sure Dr. Boyd can hand it out to his 5 board members as well. So to me, it's 6 and 1/2, but doesn't another. But if we want to go through Mr. Miller, I have no problem with that. Either way.
Mr. Chair, I'm sorry, I plan to have a sit-down meeting with Dr. Boyd next week about some of the questions I have.
Go for
So
it.
I'm not gonna comply with that. Thank you.
That's fine. I'm sure Dr. Boyd appreciates the opportunity to meet and discuss. I certainly don't think it's unreasonable.
And for information, I'm driving with him to have a meeting tomorrow with the Davenport and Associates folks about school financing for, their facilities and things like that. So if you have anything you want to get to me before 10 o'clock in the morning, I'm happy to pass that on to him as well. So.
Awesome. So the only other thing I'm going to bring up, you'd mentioned holding the March 13th as a placeholder.
April 13th.
I'm sorry, April. Apologies. Thank you. I'm just gonna let you know that week is bad for me. I will not be available. Just as fair warning to my colleagues. So
April 13th,
that whole week.
the whole week. Okay.
So okay. Anything else, Mr. Miller?
No, sir.
Okay. Then I will entertain a motion for adjournment.
Mr. Chair, I move to adjourn to March 30th, 2023, 6 p.m. in the board room.
Boardroom?
6:30? 6 o'clock in the boardroom.
Okay. We have
Second.
a motion properly seconded. Any discussion? All right, all in favor say aye.
Aye.
Any opposed? Chair votes aye. Motion carries. We are adjourned.